Good morning, all. This is Vignesh Kumar. Today, actually, I'm going to speak about fooling the brain and fooling the pain. So, that is the topic. For a lot of amputated patients, amputation is just a part of the limb which can be removed due to lack of vascular supply in accidents or due to diabetic gangrene like. So such patients post-operatively, most often patient used to have phantom limb pain, which is very common. So in post-amputated patients, let me explain very simply. Patient feels pain which is coming from the body part that is no longer there. 60 to 80% of the patients having this phantom limb pain. Everyone believes that it is a psychological problem, but new research with evidences saying it's real, originate from spinal cord to brain, and it is a faulty wiring of the sensory cortex of the brain. And it is main important thing is the processing the sensory inputs which executes the movements, and some sort of mismatching takes place. So the phantom limb pain found to be caused by the changes occurring in the brain cortex and brain, especially continuously sending the signals from the nerve endings, and the signals which is goes towards the sensory cortex of the brain, which is very common. And this phantom limb, the patients used to feel, if you ask the patients, they used to feel there is an itching or some sort of a pain a remaining part of the limb. So it's very common, and this problem may be chronic for a longer period of a time, even years together also patients will have. If you have treated appropriately in the initial stage itself, we can prevent it. So it is not, of course, it is some sort of a psychological problem, like, so they refer psychiatrists and give antidepressant drugs also. Commonly the orthopedic surgeons or general surgeons used to prescribe non-steroidal anti-inflammatory drugs along with depression drugs. But there is a ample of evidence which shows other therapies, supportive therapies, like a comprehensive rehabilitation program, which showing a moderate evidence in all systematic reviews, which is called as a graded motor imagery, which is a wonderful combinations of three types of therapy. One is laterality recognition, and another is mental and motor imagery, and third one is mirror therapy, which is a complemented therapy, which was designed in 1958 by Professor V. Ramachandran, neurologist in United States of America, California. It's a great, important, profounding research. The mirror, which produces the illusions, perceptions in the brain, and the higher cortical representation of the brain, which causes a reorganization. He found this therapy as mainly by neuronal plasticity on the basis of that. So how this graded motor imagery techniques which can be applied, these three types of techniques in the amputated patients. For example, I just wanted to tell proudly, I am working in a government medical college hospital. Just 3 to 4 years back, during this COVID started period, there is a surgeon who is a vascular surgeon who only introduced and emphasized me, why don't you try mirror therapy for phantom limb pain? So I started reading the research works and different types of articles, and the doctor himself brings the patient to the physiotherapy, and we both standing together, and he advised me to give TENS therapy for the pain areas, and after that just a mirror, long mirror, which used to keep in center of the limb, and the amputated limb covered by a blanket or some sort of a towel, and the mirror kept in between, and the mirror image perceived by the patient illusions of the intact limb. So there are two types of exercises, motor exercise and sensory exercises. Motor exercises, like for example below knee amputation, we can do ankle movements, knee movements, and sensory, like different types of textures brushes or pins or needles or balls to touch the part. So all these illusions, daily practice, 10 to 15 minutes to maximum 30 minutes, we can give for up to 1 month. Automatically the phantom limb pain completely will be disappear because of the reorganization in the sensory cortex takes place by means of this mirror therapy. And lateral recognition, different parts of the body which can be stored in mobile app and shows the upper limb, lower limb images, and ask the patient to find out which side it is, right or left, discrimination of the sides. That is basically a laterality recognition. And graded motor imagery, just thinking basically by means of mental stimulation, imagining the movements of limb movements. For example, if the limb which can be taken above the thigh, patient used to assume the knee movements. So this sort of a mental stimulation and some sort of motor imagery thinking in the brain, even this can be stored in the mobile apps. So such a type of a therapy combinations, graded motor imagery, that the laterality recognition as well as the mirror therapy proves to be the wonderful technique to reduces the phantom limb. So I just proudly wanted to say that as a government physiotherapist, I've been treated so far hundreds of patients with below knee, above knee, and above elbow, below elbow. And here I just wanted to tell you one metaphor. A patient from Thuthukudi, he had an accident of electrical shock, got a severe gangrene. Start from the beginning itself in IRCU itself. I have been treated for chest physiotherapy, and our vascular surgeon and our, proudly speaking, our plastic surgeon, both of them are eminently treated the patient and saved his limbs. For example, upper right upper below elbow amputation has been done, and right lower below knee amputation has been done. So after that, post-operatively phantom limb mirror therapy I have given, stump exercises I have given, and stump measurement taken, and appropriate processes which can be given, appropriate gait training. Now the person is working with the wheel scooters and he is going to domestic workers. So now recently he has been recognized by our Honorable Chief Minister, and he has given some beneficiaries also. So these type of important rehabilitation technique which can be useful for every physiotherapist who has been come across the amputated limbs for both upper as well as the lower limbs. So I think this important information is very useful for viewing all doctors, physiotherapists, nurses, and medical students and public persons. Thank you one and all. Wish you all happy Diwali. Thank you.